Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, we'll discuss the latest in healthcare, health IT, and compliance.
In this week's episode, we discuss deaths during nursing home Ida evacuation, measles found in travelers coming to Kentucky, and rabid bat cases, part 2. Let's wrap things up. This is episode 103 for the week of September 20th. I'm Matt Moneypenny.
And I'm Maria.
And I'm Kaylee.
And we've got an entire clique here today. So I'm excited about that. It's a whole group, a whole gaggle, if you will.
Nice.
Welcome.
Thank you.
Before we get started, our diagnosis code of the week is X50.0XXA, or overexertion from strenuous movement or load. Initial encounter. Wow, there's a lot to unpack here.
There is a lot. Exactly. But don't overextend. You know what? Let's just keep going.
Let's go. Don't overexert yourself by trying to think about
Listen, people, don't overexert yourself. You don't want to hurt yourself when you're moving, which is what I'm doing next week. Yay.
Yeah, you are.
Wow, we're going to have to use this. Maybe we'll do you next week. Like, it's your story.
It's my story, like my actual
diagnosis
story.
For the diagnosis code, we can like do it take 2 episode.
Yeah, I can be like a silhouette in like a documentary and have a distorted voice and be like, I used to move.
Yeah, your voice is all messed up.
Exactly. Anyways, let's get into the news. First up, we have cause of death, laziness, cutting corners, or immoral owner, ? 7 nursing homes evacuated their residents to a warehouse in Independence, Louisiana to shelter during Hurricane Ida. 7 residents died before a state health official transported hundreds of people from the warehouse to other nursing facilities on September 2nd, 5 days after the hurricane tore through the state. Emergency preparedness plans and surveys reveal that the 7 facilities plan to evacuate their residences to the warehouse, which had a listed capacity of 700 beds, despite the nursing homes having more than 1,000 combined licensed beds. By the time the health department closed down the warehouse evacuation site, it was well over its planned capacity by at least 143 evacuees. At least 30 calls to 911 from the facility requested emergency assistance for residents experiencing a variety of medical episodes, including heart attacks and seizures. 2 lawsuits have since been filed against the owner of all 7 nursing facilities and the warehouse over the evacuation disaster. So if you didn't catch that, the number 7 is very important to this story. So we have 7 nursing homes, 7 residents who died with a place that has 7 facilities planned to evacuate with a listed capacity of 700 beds. Is that like an omen or something, guys?
What does it mean?
Yeah.
What do these numbers mean, Mason? What do they mean?
So I think it's all 3, by the way. The laziness, cutting corners, immoral owner. What do you think?
I agree. Kaylee, what do you think?
I'm still stuck on the number thing, but
okay, we'll get back to you.
Get back to you when I form a thought. But no, it seems as though there was no clear plan, and obviously, when you overextend your resources, something bad's going to happen, right?
True, very true. So, nursing home facilities, I feel like they always have some issues. I feel like there's just a lot of healthcare organizations, they just are overextending themselves, whether it be through not enough employees or too many people, because it's also cost driven. So it's an ethical dilemma, if you will.
Sure.
Those poor people.
I know.
They were just trying to live their lives.
Mm-hmm.
As is everyone, I guess.
Hindsight. We're all out here.
We're all here living our lives.
Yeah.
All right. Take it away, Kaylee.
Let's get into measles. Apparently they're back, sort of. 5 people who recently traveled to Virginia from Afghanistan have been diagnosed with measles, according to the Virginia Department of Health. Officials said that the people were part of the U.S. government's emergency evacuation efforts from Afghanistan, which recently came under Taliban rule. They did not offer specifics about where the infected people are located, but they're working to identify and contact people who may have been exposed. Virginia is reporting its measles cases in the wake of the U.S. government halting U.S.-bound flights of Afghan evacuees Friday. The decision was made by U.S. Customs and Border Protection on the recommendation of the Centers for Disease Control and Prevention.
Who's going to Virginia?
Also, I
People
like
from
how
Afghanistan, I guess.
No, I'm saying like, let's go, right?
Oh, yeah, let's hit it. Yeah.
and I also
I don't
like
want
how it
measles.
says it doesn't say where the people are located, but I'm gonna assume that it's in Virginia.
I'm gonna assume that
I'm gonna put some money down that they're located in that state.
and they
They
did not
live in Virginia.
Yeah.
Nobody
come to Ohio.
no one came back to Ohio, so it's fine.
So it's all
Yeah,
good.
we don't want anybody to come to Ohio, to be honest, so it's okay. So I looked up, I didn't think about Afghanistan and diseases because they've been in the news for, what's going on with the Taliban. But I looked up Afghanistan COVID because everything that's going on is probably a super spreader event technically, right? But there's only been 86 new cases. But I did see another headline that says the US CDC advises against travel to Afghanistan and other countries over COVID-19.
Right.
I don't think that's necessarily true. I feel like the CDC is like, hey, probably should just advise people all across the board not to go to Afghanistan right now because of what's going on there, which is unfortunate. But I feel like that's a slanted headline.
A little bit.
Yes.
Yeah, a little bit.
A little bit.
Yeah, a little bit.
I mean, what's another disease,
I know what. Yeah, right. It's just measles, right? What's the big
Right.
deal? What's the
Once
big
I
deal?
said it, I felt bad.
Well, okay.
Yeah,
Don't you get-
that's good.
I was gonna say,
Don't
you
you get vaccinated for measles when you're like a baby?
a bebe?
I think so.
That's
that was
what
cool. You guys said that in sync, like a course, a choir.
One, two,
three.
That's a one, two, three.
Never
Never mind.
We were not on the same page for the
There's a lot
second
going on
round.
over there, guys. I apologize to our
Yeah.
listeners.
That's why we have to
Basically,
be-
if you live in Virginia, watch out for measles. It's only 5 people, but who knows what could happen. I also believe you are right about getting vaccinated for measles. So I
Yeah.
don't necessarily know what happened there. Maybe these people didn't get their booster shots because I think that's something you need to get a booster
Wait,
for. but
Oh,
I'm not
what?
sure.
really? Oh, shit.
Oh,
That's something you get a booster for?
I don't
Probably.
know.
Let me see.
I have not.
Booster.
Public health system has failed me because I did not know if that is true. But
I think there should just be clear guidelines on when you need to get booster shots, what to avoid.
I need like a chart.
I need a chart. Will I go to the doctor? Probably not.
Okay,
but
yeah. So you do get 2 vaccines for measles or MMR, right? That's the booster. That's
I
the
feel
booster
like-
shot.
Right. When do you get them?
I feel like you
You
get them
get
when you're.
them.
Oh, go ahead.
They get them when you're 12 months to 15 months, and then you get it again when you're 4 to 6 years.
Oh, we're good.
Oh, we're
Yeah,
fine.
so you guys are good. If
I
you
think I
got
come
your
to Ohio.
MMR shot, you guys are good. Don't
Yeah,
worry about
I'm gonna-
measles.
I'm gonna dig into my medical records, but we should be fine.
I'm vaxxed up.
Perfect. I'm gonna post my medical records on social media. I'm just kidding.
Yeah, that sounds good.
You actually shouldn't.
Oh, thank you.
That's going batty in broad daylight. Public health officials in Middleton, Wisconsin found a rabid bat on a residential sidewalk on Middleton's north side over the weekend. Officials said there were no known exposures as of Tuesday morning. Public health animal services staff plan to canvass the neighborhood where the bat was found to track down any potential exposures. While not all bats carry rabies, it is not uncommon to find a bat in Wisconsin and surrounding states. Environmental health supervisors say that if you find a bat outside that is not acting normally, especially if they're seen during the day or on the ground, don't touch it. Call the animal service office dispatch right away. So far this year, 15 bats have tested positive for rabies in Wisconsin. 11 of those bats have been found in Dane County.
So, if you guys didn't know, we had a rabid bat case from California Zoo earlier this year where basically, I'm pretty sure if I remember, the zoo or the bat got out of its enclosure and it was just like hanging out rabid in the zoo. So
That's kind of scary.
scary times. But also, you made a good point. I don't necessarily know what regular bat behavior is.
I don't either.
I do.
What?
you?
Go ahead. Continue,
So-
Kaylee.
All I pictured was like a bat with like a top hat and a monocle, like walking
Whistling.
around, like whistling.
Don't
And he's
like-
like going to a meeting in a hurry.
Yeah,
and
he's
it's,
like
windy,
going
and he's
going
holding
to
his hat down.
He's a well-rounded bat.
Yeah, he's going to record a podcast. Later on, he has dinner with the fam.
Wow. That's cool. That's a
Fun
very
story. Before I knew this whole thing, because I now know, even before this story, that bats do tend to carry rabies. When I was in college and I lived in a sorority house, there was a bat loose in the sorority house, and I didn't know the risk of it, so I just caught it with the towel.
Oh my gosh. Wow.
And put it outside. So this hits close to home, I guess, is what I'm trying to say.
This story really hits hard.
Just
I almost got
had a flashback there.
Yeah.
He was cute though. He was a little guy, and I think he was actually normal.
No, I think he was acting normal. I did a similar thing.
You have a top hat?
No,
he didn't have a top hat.
He could have been Rabid then.
Well, and
fair
see,
point.
I'm lucky to be here.
Yeah, I mean, I feel like everyone has a bad story, except for mine was a little bit less fun than yours. I didn't catch it. My roommate saw a bat in the hallway, and then I locked her out of the door.
With the bat?
Hallway?
You just left her out there to fend for herself against the bat? Oh my God.
I just figured they would be friends. I didn't want to be friends with the bat because I had too many friends at that point. So I just locked her out of the room.
Bats love Kaylee.
Bats love Kaylee.
I already had way too many bat friends at that point.
Yeah,
half of them had rabies. Half of them were acting normally.
I'm sorry. I have way too many bat friends already. I can't afford to have another one. So I'm going to lock you out here with my roommate because she needs bat friends. So
yeah, it got really complicated. And I had to tell him, dude, I can't tell. And I couldn't see if he was wearing a top hat or not. So probably had rabies.
Could have been Rabid. So let my roommate fend for herself. Anyways, if you're in Wisconsin and you live in Dane County, which I don't know what the population of Dane County is. What is Dane County's population?
I can do a little goops.
Ooh, 500,000 people live there. So, that's a threat. I'd say 15 bats versus 500,000. That could end up being something serious. So be careful.
For rabies. Oh, there's not?
No.
I thought there was. In the office, they said that there's a cure for rabies.
There's not a cure for rabies.
There's not a cure for rabies if you
I'm Googling it.
There's not a cure. If you get the shot early enough, you can prevent it, but I'm pretty sure there's not, like, once you have it.
Yeah, no, I think you're right. You're right. If you can get it, there's preventative measures you can take, but if you
it's like within a certain amount of hours afterwards. Yeah. This girl in Thailand, when I was there, got bit by a monkey on on a tour, and she had to leave immediately to go get rabies shots.
Jeez.
Yeah.
Wow. Anyways, let's get on to our next segment.
BREACH, Breach Patrol. It's a breach! All of the latest cybersecurity breaches.
Welcome to Breach Patrol. We talk about the latest breaches all across the world. First up, we have Get Health needs to get some help. Researchers with Website Planet discovered a non-password protected database on June 30th that contained over 61 million records belonging to fitness tracking wearable devices and apps. The unsecured database belonged to Get Health, whose business surrounds providing access to data related to health and fitness devices and apps. Many of the records contained user data that included first and last name, display name, dates of birth, weight, height, gender, and geolocation. A limited sampling of 20,000 records uncovered the majority of the exposed records were from Fitbit devices and Apple Health Kit. It's unclear how long these records were exposed or who else may have had access to the data set, but the report made it clear that it was not implying any wrongdoing by Get Health customers or partners, nor are they implying any data was at risk.
Great.
So a non-password protected database with 61 million records isn't a data risk. I don't know about that. Thoughts? I think that's a risk.
Well, as somebody who I'm pretty sure has Apple Health Kit, I don't need people knowing my weight. The rest of that I'm fine with. I don't care.
You're like,
but weight?
Yeah, they take all the averages of your heart rate and they're like, oh, Kaylee must be stressed right now. Her heart rate is a little bit higher than it was a couple minutes ago. Who knows?
See, I don't have one of those fancy gadgets, so I have like a plain white T-shirt where I have like a Sharpie and I just write stuff as I like measure it.
Oh,
and
that's pretty neat.
So I don't care if I guess I don't see the problem because people see my stuff all the time. So
that's true. I think the bigger problem is not the fact that, other than, first and last name, date of birth, which is pretty much, and gender, which is pretty much what you can get all from Facebook already if you have a Facebook profile, is if they ever allow, and it's probably going to end up going this way anyways, if these smartwatches get so smart that they can provide you actual information that's like, you know, like health information, like blood sugar level or something like that, then there needs to be more precautions taken in these databases. What do you guys think?
I mean, if we're going with the HIPAA rules,
Yes.
No, that was right. That was a good answer. Wait.
Because, I mean, it just makes sense that the more valuable information is available, the more protection you should have against people who want that information. But
Agreed.
I mean, it's just how do you go about that? And also, like, I don't know, who would need that kind of information? You know what I'm saying?
like if they're gonna fat
That's
shame
true.
me, do it to my face.
Yeah, no one's gonna fat shame you.
We can get that part out.
Well, isn't it
No, that-
like, isn't there on your, I know iPhone has that health, where people, if you're in an accident, can look up on your phone just your health background and stuff that it can store there.
Mhm,
I mean,
mhm.
that could be, I don't know. That could
Yeah,
be
no,
something
that's a good
that
point.
would
I don't know if that might have actual protections put on it, but that's a good point
I would
in
think
terms
it
of
would.
the argument against, you know, they should already have that stuff in place, which
Right. So why
I
don't they
agree.
have that protection?
Always use protection, kids,
Okay.
with apps.
with apps and your
She's
data.
talking. She's going.
I'm going. I'm saying a lot of things.
Saying a lot of things right now.
iPhones getting hacked. A series of emergency security updates were released on Monday after researchers said a system flaw allowed spyware from a hacker for hire firm to directly infect the iPhone of an activist. Researchers at the University of Toronto Citizen Lab said the security vulnerability affected all operating systems under Apple. The researchers who discovered the unwanted code on September 7th and immediately contacted Apple said it was the first time a zero-click exploit had been identified and analyzed. According to an Apple blog post, a security update is being issued for iPhones and iPads after maliciously crafted PDF or web content could result in them getting hacked. A researcher explained that malicious image files were transferred to the victim's phone through the iMessage instant messaging app before the device was hacked with NSO's Pegasus spyware.
So a zero-click exploit means that the user doesn't have to do anything in order to get hacked. Like usually if it's a phishing attempt or something, they have to download the attachment or, you know, to do some action before they can get hacked to before that actually kind of executes. But with a zero-click exploit, they can just go to whoever's phone or Apple device. That's what that is. So basically with this exploit, if you haven't updated your Apple devices, these people who have this code can just get into your phone and like go through your data or, you know, listen like eavesdrop on conversations, just have the mic open and also, you know, have the camera running. So I don't have an iPhone. I don't need to worry about that, but I think
Me neither.
Kaylee's updating hers right now.
I would never subscribe to Apple.
I'm not saying not to subscribe to Apple, but I'm saying, you know, that's not something I need to worry about. But if you're an Apple user, you should definitely update all of your devices.
I mean, my goodness, first the health kit and people,
I know
how much I weigh, and now this Apple, get it together.
Not a good look for Apple, which is also ironic because their recent marketing thing is that they're super secure and your privacy or your data is private and they never sell your data like Google and blah, blah, blah.
Ha.
They
But
are
then-
little punks.
Yeah. Smoke and mirrors, you know, that's what they're doing.
God, I don't need
But-
another liar in my life.
Oh my gosh.
Jeez. Should I leave?
So,
here?
I mean, it wasn't that.
Alright.
I mean, they turned it around pretty quick. I mean,
Yeah.
it happened on September 7th and it's the 15th at the time of recording. So, spoiler alert, if you're listening to this on Monday when it releases, we recorded on the Wednesday before. But, you know,
Yeah.
it's still scary.
Not cool, Apple, but also if you're listening, sponsor me. All right.
If you want to send me things to talk better about you in the next podcast,
Oh my gosh.
fine.
We'll call your people. Be all right. All right.
All right.
Indonesia government breach. The internal networks of 10 of Indonesia's government organizations, including the country's intelligence agency, were allegedly breached by hackers originating from China. The breach was discovered in April. The breach is suspected to be linked to a hacker group called Mustang Panda. Researchers detected Mustang Panda operated command and control servers that utilize PlugX malware. PlugX is a Trojan that grants remote access and control over an infected device. The malware has been breaching Indonesia's government agency since March of 2021. Responding to Mustang Panda's activity in Indonesia cyberspace, IT Minister Johnny G. Plate said that his ministry will work with the National Cyber and Encryption Agency to investigate the alleged breach.
I also want to know, it's a good point, because I want to know how they came up with that name, because then they're like, all right, we need a really cool name and then something cute. So Mustang Panda, like, let's do two animals and then see what we can come up with. I could just imagine a whiteboard with a bunch of different animals, and they're like, you know, circling them and drawing lines between the two and saying them out loud. And they're like, nah, that doesn't work. But Mustang Panda's got a nice ring to it.
Or they put, like, you know, those giant wheels, like the Wheel of Fortune.
Yeah.
They just had all these animals on it, and they just spun it twice and landed on Mustang and Panda. They're like, yeah, all right.
Exactly.
Sounds good.
Exactly. Kind of scary, though. I mean, the malware, it doesn't say that. Well, yeah, it says the malware has been breaching Indonesia's government. So I'm going to take that and interpret it as Indonesia's government has been affected by this malware since March of 2021, which is the PlugX malware Trojan, which basically means a Trojan horse type of malware is the type that seems like it's something good. Like, it'll be software that's like, hey, I'm going to help your computer out. And then you download it and then nothing happens. But in the meantime, they're stealing all of your information.
Yeah. That's
So the fact that this has been going on since March is bad.
Well, anytime something just pops up and is like, I'm going to help you, I feel like at this point, you don't trust it. You just got to be like,
I know. If we haven't taken anything away from this segment on this podcast, it's nothing's here to help you.
Exactly.
Trust nobody. Not even
trust no one.
As cute as a Mustang Panda.
Not even a company that's valued at $1 trillion.
Right.
No.
Like Apple.
Like Apple.
I don't believe it. But again, if they want to sponsor me.
But also sponsor me.
But also send me things.
But I don't trust you.
I don't trust you. But I could.
This is a healthy relationship.
I don't trust you, but if you pay me, I will trust you.
Yeah. Like, if I get enough benefits, I'll overlook.
That's called that's not called journalism. That's called fake news.
Fake news.
Bribery, I'll do it.
We do not accept any advertisements on this podcast.
Correct.
But that's it for this week's wrap up of your weekly healthcare news. I'm Matt Moneypenny.
I'm Maria.
I'm Kaylee.
And we'll see you next week.
Thank you for listening to the Bandage Podcast produced by eTactics.